Welcome to Standing Up. And we're live. Ayla, welcome.
All right. Thank you.
First, before we get started, I just want to thank you for the super important work you're doing. You're putting yourself in harm's way to help other people, and you really deserve all the credit and respect for that. So truly, thank you for me, and I know I'm speaking for many others with that as well. So you are working at an ICU in Pittsburgh. Can you tell us a little bit about what that's like? From what I understand, you're working 12-hour shifts every day.
So depending on the type of service that you're running in the ICU, we typically run 12-hour shifts. Whether they're nights or days, we sort of rotate through them. So you're either on a night shift schedule for a week or a day shift schedule.
Okay. And what's it like being in the ICU now? What's the situation?
So it's a little bit different than typical. Majority of our patients right now are COVID patients who are critically ill. Not that we are not taking care of the other patients. They are still being accepted to the same medical ICU. But we've never seen such high numbers of such sick patients before. And I think that's sort of changing the game a bit. So I'd say almost all of our patients are COVID and critically ill right now.
So you use the term subset. What is that exactly?
So other patients who would typically be in a medical ICU, like septic shock due to some kind of bacteria or a GI bleed or different kind of illnesses that would require critical care, are, they're still out there and they're still occurring, despite us having a pandemic. So our ICU is still taking care of both. It's not an isolated COVID unit yet, but the majority of the patients are COVID positive.
Okay, I understand. And, we're still hearing people compare this to the flu. And, obviously, if you look at the data, you just see the numbers are vastly different. So from your experience, is it normal to have people in the ICU from the flu, even during flu season?
Yeah, so we do see people in the ICU from flu, typically the older people, typically people with underlying lung disease. However, this disease is very different from the flu, and it's quite unfortunate that people are associating them. The only thing that they have in common is probably that they're both a respiratory virus, a virus that lies in the upper respiratory tract. The two main differences that I think are important to understand are, one, the actual amount of time that it incubates within the body. So the fact that flu typically incubates for about 2 days and it shows symptoms within a few days allows you to detect someone who has flu-like symptoms really fast. However, coronavirus or COVID-19 typically incubates for much longer and therefore sometimes only shows symptoms at 10 to 14 days. And therefore that person is carrying it around and spreading it for a much longer period of time. So that's one big difference. The other big difference is that we don't really know how this virus is acting, and everything that we're doing right now in the ICU and on the pulmonology floors is showing us that this is acting very differently and in a way that we haven't seen before. And therefore we're constantly acclimating and trying to change what we're doing to try and treat it without much evidence and without much known treatments, unlike the flu.
So it's more contagious because people are asymptomatic for a longer amount of time, and just the treatment is less clear. In addition to
Correct.
that,
Yeah.
is the length of hospitalization similar to the flu, or do they differ?
It's hard to say because I don't think we're at the end of this yet, and we don't have numbers. So we don't know exactly what the average length of stay is for COVID-19. I will say that there are a lot of people that have the flu who can also stay home. Whereas here it seems like 40 to 60% of people are asymptomatic, but the ones who are symptomatic are quite ill and requiring prolonged hospitalizations.
So it seems to have a much higher severity rate than the flu, and I guess that's what the concern is, that if it has such a high severity rate, then you will need lots of, the hospitals will be filled, and then we won't be able to care for everyone. Would you say that's the danger here?
Correct. And like when we talk about pandemics, we typically talk about, Ebola, for example. And a big difference here for, when it comes to mortality and morbidity is that Ebola is a self-limiting disease, whereas whoever gets it dies. Whereas here, you have so much of the society that is carrying it and infecting people. And therefore, not only is the severity worse, but the mortality is worse because it's reaching so many more people.
Okay. And do you happen to know what the what the severity rate of the flu is? I know for COVID we can't know yet. We just don't have that data. But are you familiar with the flu numbers?
I don't know.
Okay. I guess we could probably calculate it because something like tens of millions of people get it every year in the United States. So just the fact that hospitals aren't overwhelmed every year means that the severity rate probably is a fair amount lower than COVID-19. But I guess
Right.
we're still collecting the data, and we'll be much better informed in a few months' time.
Yeah, I think so too.
What what are what are you guys doing to keep yourself safe when you're working with sick patients, and are doctors and nurses getting sick?
So we're lucky enough to not have the surge like some other states have had, like New Jersey and New York, um, who have been quite impacted by this, and therefore we have the supplies that we need. For now, we are reusing what we can. We started off with just wearing the normal N95s. We now have what's called a PAPR, which is basically what is looks like a partial hazmat suit with a battery pack, clean air. Yesterday we started. Um, Yesterday we started going towards N100s, which is sort of reminiscent of like a gas mask is sort of what it looks like. It's a mask with two side filters. So I think we do have the protection that we really need. We're also being very cautious. On the nursing front, the critical care nurses that are taking care of these patients are only going into the rooms once every 4 hours. So to try and limit exposure. So I think in that sense, we have the PPE. People are inevitably going to get sick. Physicians are constantly being exposed to this. The physicians that are working in the hospital are taking care of majority of COVID patients at this point. It's just a matter of who gets symptoms and who doesn't, and trying to limit that exposure as much as possible. Thank goodness in my facility, I don't know anyone who's gotten severely ill, but there are people who are showing symptoms, and there are people who are positive and on quarantine right now and not being able to take care of patients.
Yeah, I mean, that's why the work you guys are doing is just, absolutely amazing because you're going into it knowing there's a very high chance you contract something that's potentially life-threatening. So,
Mhm.
wow. Would you say that you guys are near full capacity?
So we're not. And I think this you're going to hear this from a lot of different physicians in different parts of the country. The overall capacity of the hospitals are actually down because a lot of people are not coming in. So for us, the capacity is actually quite low, and it's quite eerie when you walk around the hospital because patient load is low, as well as all the consulting providers. Most consulting providers are working from home. Most of the patients that are there are COVID. So, acute, like we talked about, severity, acuity is high, but the total number of patients right now, at least in our facility, is low.
And the reason for that is just because people don't want to go to the hospital right now.
Yeah. hmm
So
I think so. I think that's part of it. Also, all elective surgeries have been canceled. So, things like a hip replacement that would have been done here at this time and a patient would have stayed in the hospital for 2 or 3 days after, they're not happening. So all those patients with elective procedures are home right now getting rescheduled for once this is over.
okay, interesting. It creates an interesting situation because it's like there's a lot of people who have been downplaying the severity of COVID-19, and it's like we did a whole lot to protect ourselves, social distancing, postponing elective procedures. And all this caused us to be in a situation where really, relatively speaking, we're not losing that many people. And relatively speaking, the hospitals aren't flooded like were predicted. And it's ironic because the people who have been downplaying it now kind of use this as like as proof that what they've been saying the whole time is true. They're like, "Oh, you see, it's a hoax."
Yeah.
But
Correct. And the fear is that once people start to get comfortable and feel like we've controlled this, they're going to go back out, and that's what people are worried about with a resurgence of this virus. And I think getting too comfortable is sort of dangerous in this situation. We're not over the hump yet.
right. It seems like we need to like ease back into normal life slowly. Like, maybe we could start working again soon, but not open up nightclubs and movie theaters. Would you say that seems like like an incremental approach forward from here on out?
Yeah, I've heard different ideas, like people doing shift work, going to work, like some people going in the morning, some people going in the afternoon. People are trying to get creative for when we do lift the ban, so to speak, or so I think people are trying to get creative. I do think that's a safer approach. Everyone going back out right now, at least, and probably for the next few weeks, is too dangerous.
Now, I'm sure you've heard this too. There's a lot of talk about the numbers being artificially inflated, that if somebody dies of a heart attack, but they're COVID positive, then it will be listed as a COVID death. Can you speak on that?
Yeah, so I can't speak to the inflated numbers as much because I genuinely don't know. But what I will say is that this gets to the point where someone is critically ill, is affecting multiple organs, right? And causes what we call multi-organ dysfunction. And what happens is that people are going to have cardiac problems, people are going to have renal problems, kidney problems, people are going to have brain problems, all from the same virus. And therefore, trying to say exactly what someone died from is going to be really hard. And you can really blame it all on COVID, because some people are having heart attacks, some people are having neurologic effects, all of it from COVID.
Okay, so what you're saying is the vast majority of people who have pre-existing conditions, we can't know exactly what they died from, and it's likely it's just a combination. They had heart disease, and COVID is what pushed them over the edge. I guess there's some cases like, I don't even know if this happened, but somebody said if you die of a heart attack and you're COVID positive, then you'll get written as a COVID death. Now, that's more an issue of hospital policy. I don't think that's really your domain, but I punched some numbers, and even if they're counting all deaths, COVID deaths, then it will only increase the COVID deaths by between 10 to 20%. So it still doesn't really inflate the numbers as large as what people are making it seem to be.
And I think it's important to know that the two main comorbidities that are associated with mortality right now, or at least what we know of from the CDC, is cardiovascular disease, which is heart disease, and diabetes. And therefore, it's really hard to say for someone who has underlying heart disease and they suddenly become COVID positive and have a heart attack, that it's not because of COVID, because we know that COVID is affecting the heart quite dramatically. So obviously anyone who has underlying heart disease, or is, like you said, is going to be pushed over the edge, with this virus.
Well, Ayla, thank you so much. You've given me and all the viewers so much information. I think a lot of people are looking to just try to get a look on the inside. Is there anything else you'd like to add or say, something of importance you'd like to leave us with?
I really want to thank everyone who's being so supportive of the medical community. I don't think any of us expected that. And that outpouring of love is amazing. And we're seeing it internationally, and we're seeing it in our own neighborhoods. And I think that's really keeping us motivated to do what we're doing. It is a scary time for everybody, and it's taking that much extra effort for people to be empathetic and compassionate towards one another. So thank you.